Putting the X in success. Conversations that matter during Men's Health Week and beyond. With 𝘀𝗵cie UK's Gyan Tayal and Dr Care Anywhere's Chief Medical Officer, Dr Tim Bray.
So welcome to the 𝘀𝗵cie UK podcast. My name is Gyan Tayal. I'm the Head of Commercial Development over at 𝘀𝗀cie. And I'm joined today by Dr Tim Bray, who's the Chief Medical Officer at Dr Care Anywhere. Nice to meet you, Tim.
Hi, Gyan. Thanks for having me here today.
Thank you for coming. So today we're going to be exploring men's health, taking a deeper dive into the mental and physical issues surrounding men's health. What are some of the trends that we're seeing, but also what are some of the preventative measures that we can take, and also proactive things that organisations can do to promote men's health in the workforce. So before we start, Tim, you don't become a Chief Medical Officer overnight. Tell us a little bit about yourself and also a little bit about Dr Care Anywhere.
Well, firstly, thanks for having me here today. It's so great to be able to talk about men's health and promote some of the work we're doing and maybe some of the unmet needs. But yes, about me. I'm Chief Medical Officer at Dr Care Anywhere. I'm a GP by trade. I've been a GP since, probably 2012 was when I qualified as a GP. I always had an interest in around technology and how we could do things better. How can we transform ways of working and models of care to ultimately improve access for patients and better patient outcomes. I also have a strong interest in clinical research and letting patients have access to treatments and care that they might not usually get access to. So I started my journey in the NHS, which was a really good foundation for the work around innovation. And as part of that, I got involved with Dr Care Anywhere during a pilot. And we were piloting virtual consultations in the NHS. And this was long before COVID. It was a very new, novel concept. It was a challenge at the time to trial it. But yes, the patients loved it. Yeah. And the clinicians enjoyed working on it. And that's how I got introduced to Dr Care Anywhere. And then through that relationship, I worked more with them and eventually joined the company in 2018 as one of the clinical directors. And my role there was focused on innovation, developing new stuff, which, I loved. It was great. And then over the next couple of years, I moved more into an operational role. And about 2.5 years ago, I moved into the Chief Medical Officer position, heading up the clinical team. So right now at Dr Care Anywhere, we're one of the largest virtual healthcare providers in the UK. We have over 3.5 million patients. We have a clinical workforce of around 500 to 600 clinicians, and that's made up of GPs, advanced nurse practitioners, and specialists. We deliver care 24/7, 365 days a year, and have great appointment availability.
It is very innovative. I've been using the service myself over the last year, and it's great just to be able to get an appointment when I want to, but also for my kids as well.
Yeah.
So innovation, I get that. And I'm guessing from the amount of users that you said that you're servicing at the moment, you've got a lot of data and a lot of statistics. So let's take a deeper dive into that.
Yeah.
What kind of data or trends are you getting, are you seeing from the people that you serve?
So, it's really interesting, actually, because ultimately the data that we have helps improve our services and it helps us address maybe some of the unmet needs in our patient population. And one of the trends we're seeing is, and which is particularly pertinent for why we're here today and talking about men's health, is that we're seeing a greater proportion of our female patients present to us around their health concerns rather than our male patients. And then when you dive into the data and you look at some of those top issues for our male patients, you're seeing that the top issues, the majority tend to be musculoskeletal problems, hip and knee problems, fast followed by psychological problems, so anxiety and depression. For me, this is concerning in the sense that there's a clear link between physical and psychological problems. And as many of us will know, I think we've all experienced some physical problems that can impact your mental health and vice versa. But when you look at sort of bigger data, bigger trends around men's health, I think it's important for us to try and address the issue around why men are not necessarily presenting to healthcare services when we know they have similar and overlapping problems with women. You know, why are men not using our services as much as our female patients?
Yeah, and I think it's something we need to explore. It's very interesting what you're saying around the top, I guess, use for the services down physical. Would that be down to more that men would take more physical roles in the workplace? Are you seeing that? Because if that is the case, I really want to dive more into like the mental aspects of in terms of why men are using your services. There were some statistics that I came across. So Mental Health UK said that only of their services and referrals being referred to a psychological therapist, only 36% of the patients are men.
Yeah.
And, you know, if we take a little bit deeper than that, one of the biggest issues that we're seeing today is when we look at suicides, and they say 75% of deaths that come from suicide, it's based on men. So I do think it's interesting that you see such a big area of concern around men's health and mentality, but then from what you're saying is that men are using the service a lot less.
Yeah, I think you're exactly right. I guess to your first point around muscle, bones and joints problems, musculoskeletal problems, I think traditionally men were involved in more labour-intensive roles, and certainly veterans as well. There was a bigger proportion of veterans are made up of men than women, and therefore it's not surprising in certain age groups where the demographic at the time was very much sort of sat within roles and sectors, we see increased musculoskeletal concerns sort of weighted towards men compared to women. That's changing as we're seeing more opportunities, more equality and diversity in different roles. But certainly if you go back 10, 20, 30, 40 years where, you know, there were fairly some male dominant roles and sectors, yes, you will see where those roles have taken their toll on people. And you're right to call out as well the psychological thing. That does bother me. We know that suicide rates are higher in men, but at the same time, we're seeing lower engagement with mental health services from men. And we're seeing lower engagement in just accessing help from men. So there seems to be a disconnect there. And yeah, I hope after today we can hopefully encourage anyone listening that, you know, it is good to get help. Because, you know, you've got a service at your fingertips available to help you. So, and our clinicians want to help you. So, yeah, it's about just taking that first step to reach out.
I'm a really big believer in terms of being able to look at the whole person. And, you know, we're talking about mental health, we're talking about physical health, but we're also talking about, I guess, emotional health. How are they connected?
As clinicians, we're trained to think about people holistically as a whole, and there's three parts to that. You've got the biological, the psychological, and the social aspects. So biological, physical symptoms. My knee hurts. It's bruised. It's swollen. Psychological. I'm worried about what it could be. You know, it's keeping me up at night. I'm not sleeping, I'm anxious, I'm stressed. And then social, how am I going to do my job? I can't cycle to work now. How do I get to work? And when you think about the person as a whole, that's when you can start really sort of tackling managing that health concern, because we're human, aren't we? So when you are ill, it's, you know, there's more going on sometimes than just the physical. Also vice versa. For instance, a really good example is if someone's suffering with anxiety, it's not uncommon for your bowels to react as well. And we see for patients who suffer with irritable bowel syndrome, for instance, where they're in anxious situations, and a lot of people find this in the workplace, or if they're going for interviews or they're doing presentations, their bowels will react to that, and they'll need to go to the loo. Yeah, and that could be really, well, people are embarrassed about people, or it creates a level of anxiety and fear around doing things that might trigger anxiety because they're worried about then the physical symptoms that'll come as a result of that.
Yeah, and then the root cause still of the original anxiety still hasn't been dealt with because I guess that's moved on to physical now.
Yeah. So it's really important to look at people as a whole. We're complex human beings. And yeah, so they all interlink. And again, with work, social situation can then make anxiety worse. They can create physical symptoms. So it's always remember that they're interlinked. Try and consider that whenever you're, I guess, approaching it. And also internally think, well, you know, how is this making me feel? How's it going to impact what I do next?
So Tim, with all that experience, tell us, what are the current trends? Tell us some stats that you're seeing around men's health.
A stat that I find quite staggering, especially when everyone's working hard, is 1 in 5 men never make it to retirement, which is 20% of people who are putting away for their pensions never make it to retirement, which is I think quite staggering, really. Yeah. The other thing that I'm particularly, I guess, that bothers me is around how types of roles and socio-economic factors can impact health expectancy. So, for instance, men in unskilled work are 3 times more likely to commit suicide than those who are in senior management. We're also seeing the richest men live at least 10 years longer than the poorest. And those inequalities really bother me as a clinician. And so I'm really keen to, I guess, encourage and promote people accessing care, because I think, to your point, early intervention, getting help, talking, if you've got a service like Dr Care Anywhere available to you, use it. And then hopefully we can all work towards changing some of these stats. So actually more people see their retirement, less men are committing suicide, and actually that gap between the richest and the poorest men, because ultimately workplaces are offering often virtual healthcare services to their whole workforce, use it.
You can probably assume, okay, if you're richer, you're going to live longer. It's a shocking stat, what you said about 1 in 5 not reaching, retirement. I know, suicide itself is the biggest killer of men under 50. Is this purely access to resources, or is it actually the educational piece behind it?
I think there's the educational piece, so raising awareness. There's the stigma behavioural piece. And then there is the, access to the services and benefits, whether that is challenges to access it, or whether they just don't easily have access to it as a benefit, for instance.
Yeah, and it's interesting when you're talking about access, because you started off talking about innovation. And if you have a look now with stuff like Dr Care Anywhere, with other benefits as well, within the wellbeing space, you can access these, wherever you are. So if you are in a workforce, or now people being more hybrid when you're remote, you can still access these services, and most of them are 24/7 available now. So that's a great step forward. What are some of the barriers that you see that's preventing men from getting the support that they may need?
So I think, like many things, there's lots of different factors that come into play, and it can be fairly complex. One of the ones is a sort of a social, cultural, stigma-related issue. So I guess there has been perceptions around weakness, around getting help, and weakness about being open and transparent. And I think there is pressure out there, and I think a lot of men feel exposed, vulnerable when they're asking for help. Again, thankfully, these are things that we're seeing getting tackled through other sort of agendas around equality, diversity, openness, inclusivity, which is great. But I think that stigma still remains, and I think for men in particular, they do find it hard to talk about, particularly their emotions. But yes, thankfully, I think with external pressures, we're seeing that slowly chip away, which is good.
I was looking at the Men's Health Forum, and they shared some interesting facts. They said 52% of men would be concerned about having time off from work.
Yeah.
And they also shared that 48% of men would be embarrassed to be able to talk to an employer about, a concern that they've had. So I hear what you're saying around those points. What are some of the things, I guess, that an employer can do, what we could do in a workplace to try and help alleviate some of these stresses I guess people have, especially men in particular?
First and foremost, it's really great for employers to have that culture of looking after their employees and promoting the health and well-being of their employees. So that it starts at the top. The cultural bit is so important. And then there's the practice what you preach. So they need to, having benefits and having access to health and well-being services like Dr Care Anywhere as a benefit is sort of a great decision of an employer to sort of promote health and well-being services. And then it is how can they encourage and empower and engage their employees to use the service. So they can do that by promoting the service, encouraging access of use to it, signposting their employees to it, and then also, I guess the final bit is enabling them to do it. So thankfully with a virtual GP service or virtual AMP service, such as Dr Care Anywhere, there is a degree of flexibility where you can take your appointment. It needs to be in an appropriate setting where you can have privacy and space.
Sure.
But if your employer is flexible around you taking time out for your appointment, the Dr Care Anywhere service, because it's on your app, you can do that from work in a quiet room. We have great availability, so you don't need to wait long for an appointment either. And so I think it's about employers enabling, encouraging their employees to use the service.
Yeah, it's interesting. So this whole subject is really personal to me. It's I had a brain tumor last year, and it came out of the blue. I wasn't aware of it, and maybe there were symptoms to it, but I was oblivious to them. I carried on working, and getting support at the time, having the physical and the emotional trauma, I feel having the tools, first of all, is really important from what you're saying. So having things like a DCA, a Dr Care Anywhere, where you can get hold of a doctor, so you're not waiting around. You're not putting that excuse in place to saying, I'll call them later or I can't get through.
Yeah.
I know, our systems at the moment are struggling with that. So I think it's a great service what you offer. But also things like the EAP to support with the wider challenges that we've got. But from what you're saying, that's not just enough. It's the culture that you want to create around that.
Yeah.
And it's interesting. I picked up you talking more about early intervention and being able to try and see and support people. There was a local football team, actually. I'm from Birmingham, you could probably tell from my accent.
It's a bit of a giveaway,
Yeah. They put a health in football event on.
Okay,
so what they did was to try and encourage the men to open up. Is they invited local charities in to do health screenings. So you can do, your blood pressure, your sugar levels.
Yeah.
And they invited their families in. So even if, we see these benefits and these tools as kind of hygiene factors now to offer your workforce well-being, the benefits in place. Yeah. But even if at the moment you've got these things or you're thinking, what else can I do? You can do these kind of events where you can get you can get charities in, you can get local people in to do these services. You never know what might be picked up from any of those.
Yeah, exactly. I think that sort of preventative piece is really important. We know men, have a shorter life expectancy compared to women.
Yeah.
And when you drill down into the data and try and look at some of the causes of that, we know there's higher rates of obesity in men, there's higher rates of diabetes in men, there's higher rates of alcohol dependency in men, and there's a high usage of recreational drug use in men. So these are all risk factors that then together can increase your chance of developing a serious disease later on in life, and unfortunately shorten life expectancy. So the sort of events and programs that you're talking about where people, promoting healthy living, healthy aging, as well as having the opportunity to do some screening, whether it's your height or weight, or whether it's your some diagnostics to screen for diabetes or your cholesterol or blood pressure. it's all really good because it makes you think around, well, what changes am I in control of that I can work with, create new healthy habits that set me up for a sort of healthier, longer life.
Yeah, that's hard though, right?
It is hard.
Changing habits is
it's really
difficult.
hard. I mean, we're talking a lot about men today, and and it's a great opportunity, as to promote as well the sharing of talking to your support networks, whether it's your spouse, your partner, your friends, family. I think it's really important sometimes to talk about any health concerns that you might have, because ultimately that support network will help you get through that, and help encourage you and promote you. So making those healthy choices is much easier when your partner's next to you, maybe saying, you don't want a second dessert, or watch out on the sugar, or stuff like that. Doing it alone is hard.
It is hard, and I feel we started off talking about obviously some of the challenges that men have versus women in terms, and I think social is one of the biggest parts of that.
Yeah.
It's great to be able to have a social circle around you.
Yeah.
But I find that men can sometimes struggle with being able to open up. You would usually find in male-dominated workforces, especially in the work that I've done, I've come across, where we've spoken to these organisations and they will say, we don't need something like an EAP because we employ predominantly men. And also, peer-to-peer men, sometimes there's a psychology around the term man up, and these kind of things can make a man feel like how I should be acting and how I should be behaving. And I know these aren't things that aren't the way we're going forward with now, but they're still prevalent. So how can you, I guess, create that social environment in a workplace to allow men to be able to open up?
It's all around the culture. So there's the culture piece. So the leadership, I guess, demonstrating the values and behaviours that we want their employees to be like, don't we? So if you don't, as role models and visible leadership around these things. The other thing that I think is quite powerful, storytelling. Telling your experience around your recent ill health, it brings it to life, and it makes you think, gosh, that could have been me. What about me? So I think what's quite powerful is where people are willing to maybe share their stories. And certainly at Dr Care Anywhere, we've had some really powerful stories where colleagues have shared their experiences of sometimes being a patient. And it just brings home around, firstly, the importance of seeking help.
Sure.
Using services that are available to you. It also raises awareness as of some of the problems as well that are out there and some of the signs and symptoms, so you can get early intervention. But I think, employers, if they could start sort of supporting colleagues to, I guess, talk about where they've used the experience, they've had a positive experience, and share how that impact made a difference, I think will be powerful to bring others along the journey and do the same.
Yeah, I do too. And talking about sharing, I think one of the areas that really helps me was at 𝘀𝗵•, we really live and breathe well-being as well. Mm-hmm. So I remember when I told my manager about it, and one of the things I believe that we can do from a workforce place is train our managers to be able to identify these areas.
Yeah.
So when we do, we're in hybrid working space now. So being able to catch up is, difficult sometimes.
Yeah.
But I do believe it's really, really important, and we should be helping train our managers around, look at the whole person. So, get to know your team, or get to know your people from a mental, physical, and social aspect. And can they identify if something is off or if something is wrong? Because I think putting that care into an individual, it should be able to allow that person to feel something's off right now or something's not right, and encourage that person to open up.
Yeah.
I think that's important. So training, to managers, frontline managers, definitely I think is important, and giving them some tools to help identify if they notice something being off. That could be that early intervention can change something, very easily.
I think you're entirely right. I think empowering managers with the skills to pick up those maybe more subtle signs that their colleague is maybe struggling or needs extra help is really important. And that, that can be quite nuanced, that can be quite hard. So I do think, training in that is really important. It's also making managers aware around what benefits are available to colleagues. Sure. Because there's one thing around them recognizing, but then they've got to know what to do about it. And I think equipping managers, I guess, with the knowledge around what benefits and services, whether it's health or well-being, are available to colleagues, will allow them to be able to effectively signpost people to use those and hopefully get help. The managers play a really pivotal role, I think, in facilitating the health and well-being of the whole company. It's really important.
Yeah. Tim, we've talked today about obviously history. We've talked about my history too. We've looked at and explored areas around what we're seeing in the UK at the moment around men's health. So thank you very much for sharing that. And we've tried to explore in terms of why that is, around, I guess, the reluctance to be able to open up, a little bit of embarrassment around there, but also external social pressures that they may feel. And we've talked about what we could do to potentially help prevent and create some early intervention around that. Was there anything else that you wanted to share today or cover off, as it is Men's Health Week? Any last bits or nuggets of advice?
No, I mean, I think, I'm a big advocate for anyone seeking help. There's lots of different groups out there that are either underrepresented or not accessing. Men are an example that we're talking about today. So I would just encourage all our listeners today, particularly in Men's Health Week, if you are concerned, please do reach out, speak to someone. And hopefully some of the leadership teams and managers in the organisations as well will hear some of it and take some of our ideas on board around how they can really equip their companies to look after their employees and colleagues and make sure that they are healthy and living long, healthy lives.
Thank you, Tim, and thank you very much for listening. I hope this conversation has empowered you to make some changes for yourself and also for those around you.
Join us next time to discover how 𝘀𝗪cie UK is putting the X in success, enhancing employee engagement and making life at work more joyful.